No matter how long or how erected a penis is, it can never go past this vaginal canal. It can never go past it. You see the cervix here? Hey beautiful people, welcome back again to my YouTube channel. This is Succinct Jumi. If you're a returning subscriber, I'm glad to have you here. Watch this video to the end, like, comment, and share to your friends. In today's video, I will be talking about 10 commonly asked questions about pregnancy and a little bit of childbirth, question. I'm thinking I'm going to do a subsequent video for questions mainly about childbirth. So this focuses more on pregnancy. And if after this video you got some questions that is burning in your heart, you really want to bring your questions to me, type it down in the comment section below or use any of my social media platform that I will be attaching to this video. Reach out to me on WhatsApp, Facebook, Telegram, Instagram, and TikTok. I would be available to answer your questions. Okay, so let's dive straight into the video. Can I get pregnant without penetration? And the answer is yes. So when I was in school, one of my tutors told us a story about a girl who was actually pregnant and she was a virgin. And after a series of investigation, questioning how could this be and all, this girl confessed to the fact that she had a foreplay, and although the man released on her laps, there was no actual sex, just the ejaculation on her laps. Now it made more sense because in about 2 to 5 mils of ejaculate, there are more than 300 millions of sperm. Okay, in a healthy man, there are more than 300 millions of sperm in just one ejaculate. So it's just a matter of finding their way, whether it was penetrative or it wasn't penetrative. Just the sperm locating the introitus. So the introitus is the opening of the vagina. Okay, as long as the sperm can swim through the introitus, guys, forget it. So the sperm could stay up to 5 days behind the vagina, inside. We call it the posterior fornix of the vagina. So if you can menstruate, even as a virgin, if you can menstruate and blood is able to pass out through that tiny introitus. So what is sperm? It's just like fluid. So if sperm could swim through, find its way to the vagina and stay there, and God help you, you're able to ovulate within that 5-day period, definitely you're going to get pregnant. So yes, my dear, pregnancy is possible even without penetration. Bottom line is, as long as the sperm can find its way through the vagina into the posterior fornix, you can get pregnant. Okay, as common as morning sickness might be in pregnancy, a lot of women, about 40% of women, do not experience morning sickness at all through pregnancy. I am a perfect example. I have never, ever experienced morning sickness, the vomiting, the saliva, excessive saliva production, a lot of things, the fatigue and everything that comes with pregnancy. I honestly cannot relate. And I've got some other women who cannot relate. But then it doesn't invalidate that morning sickness is a very crucial symptom. Is a very crucial symptom of pregnancy. So when does it begin? After a mixed period. So for most women, the first thing is they're going to observe is the mixed period, and then subsequent weeks, say like 2 weeks after a mixed period, you could start to get morning sickness. So when I say morning sickness, it doesn't just happen in the mornings alone. It could happen at any time of the day. And what do we mean by morning sickness? It's this constant fatigue, the vomiting, the tiredness that comes, sometimes for my Nigerian peeps, it give a vibe of malaria symptoms, although it may not come with fever, but every other thing, the tiredness, the fatigue, the weakness, it comes with that. Okay, so morning sickness may start as early as 4 weeks into pregnancy, and most time it resolves at the 3rd month or 12 weeks, okay, into pregnancy. Most morning sickness might resolve by then, but then we got some exceptions. I've seen women who had morning sickness all through pregnancy. Okay, so if yours is extending more than 3 months, or maybe after 3 months the severity became reduced for you, and maybe once in a while you still feel some kind of morning sickness even as late as 6, 7, 8 months in pregnancy, do not worry. Okay, you're not alone. We've got some people whose morning sickness lasts the entire pregnancy. I know it is not a very palatable experience, but it is what it is. It has happened to some women before. Okay, so just be prepared for anything. Be prepared for anything. All right, so that's that about morning sickness. Why not? Yes, my darlings, why not? Why can you not have sex in pregnancy? You can have sex in pregnancy. So this is the anatomy of the reproductive tract for a woman, okay? So you've got the vagina. Let's say this is the vagina. Then you've got the cervix, yeah. Then above the cervix here, you've got the uterus, okay? So housing the baby, all right? And the placenta. So no matter how long or how erected a penis is, it can never go past this vaginal canal. It can never go past it. You see the cervix here, normally there is a mucus at the cervix, but during pregnancy, there is a thicker cervical mucus. You know, it forms a plug, which really holds, prevents the cervix from opening all through the pregnancy. And first of all, there is no amount of penetration that would make the penis burst or or extract the mucus plug. No, it's not going to happen, except in rare cases such as a case where a woman has got incompetent cervix, or some other rare medical cases or rare obstetric cases, which I might not be going into in this video. So for a woman who has had maybe symptoms of threatened abortion and probably has been recommended bed rest, you might also be advised to stay away from sex for that period, just for that period. But then normally, in a normal case, in a normal scenario, while you're pregnant, there is no way sex can cause abortion. Yes, it is okay to exercise in pregnancy. I would also add to this question, and what type of exercise should be considered in pregnancy? To start with, guys, we've got some women who are athletes, okay, or acrobats. Like they do this strenuous exercises that requires a lot of muscles or joints, movement and stuff. They are used to that kind of exercise pre-pregnancy, okay? So if such women get pregnant, they can go ahead with it because their body are used to it, except it is medically contraindicated for them, and their doctors advise them against it. If they have been doing it pre-pregnancy, they can definitely do it in pregnancy. I saw a video of a woman rather running with a 6-month-old pregnancy, and I was like, wow, 6-month pregnancy. And I think she's the first position or so. Honestly, I can't remember now, but it's even her tummy looked small. But guys, the baby might not really be small, but she said she was about 6 months old. I was like, wow, she has been doing it. So if she does it again in pregnancy, nothing might really, nothing much might happen. And then we've got dancers, these very flexible dancers pre-pregnancy. After pregnancy, they could still continue their dancing, okay? It is good for them, okay? It is fine for them. But you that to squat is very, very difficult for you on a normal day. If you start squatting, start 50 squats, in pregnancy. You might miscarry the pregnancy because your body is not used to it, because your muscles do not have that strength. You have not built your muscles to that point where you would do such strenuous exercise. Okay, so know what works for you. Taking a walk, swimming, yes, those are still counted as exercises. Okay, the most common kind of exercise in pregnancy that is easy for everyone is taking a walk. If you like, you could walk 1 kilometer, 2 kilometers, as much as your strength can carry you. Walking is an absolutely fine exercise in pregnancy. You can dance in pregnancy, but don't do those flexible moves if you're not used to it before. Okay, stairs climbing too, climbing stairs. You could, I've got a stairs back there, something like that. You could climb up and down. You could count maybe 10 a day, 10 steps a day, to and fro, 20, 30. You could do that too. That is absolutely fine. Just stick to simple exercises. As long as you're moving your muscles, you're intentional about moving your joints and your muscles every day, that is absolutely fine. Should I eat for two in pregnancy? Some people eat like glutton in pregnancy. Under the guise of I'm pregnant, I'm eating for two. Shall I burst your bubbles? You don't need to eat for two. No, you don't need to eat for two, because why are you eating for two? I understand that there may be need for you to, you just feel like, oh, you're empty, you want to take more food, you want to eat more food. And most people, when they want to now start eating for that too, they don't eat a balanced diet. They eat more carbs. They eat in volume. They eat in quantity and not in quality. So as much as you want to eat for two, can you please invest in the quality of your food rather than quantity? Okay, let's say you love rice, you love to eat rice. What about, instead of doubling your portion, instead of eating 2 plates of rice, why don't you add some other things to the rice, such as maybe avocado, bananas, a good piece of protein, not a tiny meat, not a tiny fish, a good portion of protein. Make the meal as balanced as possible as you can. Okay, do not just pack a bowl of rice and just a tiny piece of fish, tiny piece of meat, no fruit, nothing, and you say you are eating for two. No, you're not helping yourself, you're not helping the baby. Okay, you're not getting enough nutrients to nurture the baby growing in you. So that you're eating for two, just forget about it. Deaden that eating for two idea. That idea that is making you pack a full bowl of rice without protein or with tiny protein, without fruits. Oh no, just stop it. So you can eat balanced diet. You don't need to eat for two. Literally, you don't need to eat 2 portions of food just to get the nutrients you need. So balance the diet. How much weight is okay for you to gain in pregnancy? So for a normal pregnancy, single baby, healthy mom, everything good, you should gain approximately 12 to 12.5 kg. So for some people, it could vary from 9 kg to 12 kg, but it shouldn't be more than 12.5 kg. So this means that if you were weighing 50 kg pre-pregnancy, after pregnancy or for the total period of pregnancy, you shouldn't be weighing more than 62.5 kg. Okay? Anything more than 63 kg is going to, obesity for you in that pregnancy. It's being overweight for you in that pregnancy. A lot of things contribute to weight gain in pregnancy. A lot of things such as increase in the breast size, the uterus size, the baby growing in you adding a little bit of fat in some places, So a lot of things could contribute. So we don't want to be too rigid on the kind of weight you should gain. So I think 12.5 kg is good enough for you to gain in pregnancy. So some people add as much as 15, 16, 17 kg in pregnancy. might be risky for you after pregnancy. This is what I mean. When you gain weight excessively in pregnancy, it might be difficult to shed those weight after pregnancy. So the more weight you gain in pregnancy, the more it becomes difficult for you to shed those weight after pregnancy. So as you are eating for two, this is also related to eating for two, because when you people are eating for two, you are eating more and more carbs. Although shedding weight even during postpartum period is not might not be that easy, because also you're lactating, okay? So that also adds to your weight postpartumly. But then guys, if you weigh 50 kg pre-pregnancy and after pregnancy in postpartum you're weighing 60, this is after the whole pregnancy. Some people even weigh as much as 70 after pregnancy. Not healthy for you if you ask me. That is like a whole 10 to 20 kg gain. You don't want that, okay? So because weight gain also contributes a lot of illnesses, so you don't want that. You don't want to have your baby and you start dealing with heart diseases, kidney diseases, a lot of diseases that could, that accompanies weight gain, okay? So that's that about that. You want to watch your weight. You want to cut on the carbs you eat during pregnancy. You want to eat more balanced food, okay? And you want to hydrate a lot. Yeah. Sometimes why you people eat a lot in pregnancy is because you're not staying hydrated well enough. You're not drinking enough water. If I have a bowl of rice in front of me, just like a moderate sized bowl of rice in front of me, by the time I finish the rice and I drink a glass of water or even 2 glasses of water, I should be full. But if you are the type who do not even drink water, you finish 2 bowls of rice and you still feel like you want more, because you are not even taking it with water. You're not hydrating yourself. As much as you're eating, you are not hydrating yourself orally with liquid orally as you should. So sometimes when you feel like, oh, I feel like eating, have you tried taking some juice? Have you tried taking smoothies? Have you tried taking parfait? Have you tried other things aside from major meal? Okay, so what I'm saying in essence is you want to watch on your weight even while you're pregnant. Not for anybody, not because of what people will say, but for your own health, for your own sake. Okay, how do I know I'm in labor? So for various women, the symptoms, the signs they see differs, but then there are still some remarkable signs and symptoms that would make you know you are actually in labor. One of these is show. When I say show, it means the bloody mucus that comes from the cervix, that comes like a stain. It's bloody, it's mucoid, okay? So for some women, that's the first thing they see. You may just maybe have a wee and you want to wipe down there, or you want to wash down there and you see the blood-stained mucus, okay? That should ring a bell and tell you it's something about to start. But if you have not approached your due date and you see the signs, this mucus plug or other signs that I will be talking about now, then you should go to the hospital, visit your doctor or call your midwife just to confirm with them if whatever you have seen is fine. So for some women, what they see is the breaking of the waters, okay? Maybe you're just walking and your water just broke. Feels like you just wee on yourself and it feels like, oh, I didn't feel like I wanted to wee. So why did I wet myself all of a sudden? It is not wee, it is your water that has broken. And this is, the sac of water housing your baby. So this is like the 4 waters has started gushing and has broken, and you can see the 4 waters out of you, okay? For some women, it is just the regular rhythmic contractions. Not regular rhythmic contraction, painful, regular and rhythmic contraction. So when I say painful, it is coming. You can feel pain. This is definitely not Braxton Hicks. This is definitely not the contractions that come and go. Then when I say regular, maybe it comes, when I say regular and rhythmic, if it's coming every 3 minutes, you know that, set your time. This is coming every 3 minutes. You know this is definitely labor. It's coming every 3 minutes like that, and it has persisted for like a matter of hour, maybe 2-3 hours. You could say, fine, is it labor about to start? Any of the three might come first. For you, it could be breaking of the waters. For some women, it could be contraction. Some women do not even see the bloody mucus at all. It's only on examination, when the midwife is examining, that's when we see the mucus. Okay. For some people, they do not even break waters until the baby is about to come out. Okay. So just watch out for any of those three signs. If it's a normal labor, watch out for any of those three signs: the show, the milk, the breaking of waters, and the contraction. So, can I eat in labor? Of course you can eat in labor, but we want to advise you to keep it light. Okay, light diet, free fluids. Okay, because sometimes situations change drastically in pregnancy, and you might have, the need to have a emergency cesarean section. So sometimes you want to consider how long ago you've eaten. So if you've kept a light diet all through labor, sometimes it's easy to want to go ahead with cesarean section. But if in labor, maybe when you're 4 centimeters, you just finish eating a big wrap of swallow or mac and cheese, you've just had mac and cheese, or if you have had a big bowl of heavy meal, it might be difficult to salvage situation by having a cesarean section. Okay, so you want to keep it simple. You want to keep your diet as light as you can. You can have some energy drinks, just to keep you just give you strength, okay, through labor, and also hydrate you. Okay, you can, something as simple as sips of water, okay, can also go a long way. You just keep it light and simple in labor, but you don't have to fast just because you're in labor. As a matter of fact, you need strength to be able to push that bundle of joy out. What is the best multivitamin to use during pregnancy? Okay, so this, I'm just going to tell you the absolute truth. Okay, we have quite a number of multivitamins now, and I think one very popular one is pregnant care. Okay, I'm not saying pregnant care is not good, okay, but then it could be expensive for some women. Yeah, pregnant care could be expensive. I don't know, I really do not know so many multivitamins about pregnancy, because honestly I do not care much about branded multivitamins in pregnancy. But the most important multivitamins or micronutrients, supplements to use in pregnancy are those that contains folic acid or folate, iron, calcium, and vitamins generally, probably vitamin C, E, D, A, whatever. The good thing about vitamins are you can find them in day-to-day groceries, okay? Like your fruits, your bananas, your oranges, your avocado, not pineapple this time around, because pineapple has been, associated with risk of preterm labor, except of course you're late in pregnancy and you really want to go into labor, then you can have pineapple. But pineapple generally is not a fruit we encourage pregnant women to have. Okay, so but all other fruits, peach, pine, you can have them. It contains a lot of vitamins you will need for the baby and even for yourself. So apart from vitamins that you could get in fruits, folic acid and iron tablets, very important in labor. So you may not get iron in fruits, you may not get good quantity of folic acid or folate in the fruits or your day-to-day food. That is why I encourage to get folic acid. If you cannot afford the branded multivitamins, like pregnant care, if you cannot afford it, guys, try folic acid. You can get folic acid as a tablet or iron tablet or liquid, whatever form you want to get them. These two, very, very, very important. You could get calcium in your milk. You could get calcium in your unripe plantain and some other food like that. But folic acid and iron tablet, very important. But if you are able to afford pregnant care supplements such as pregnant care or other kind of branded supplements, why not? The good thing about this branded supplement is they already contain everything, you know, instead of having to take folic acid or folate separately, having to take iron separately, having to take calcium separately. Guys, you have everything in pregnant care. You have everything in all these brands. Sorry, I'm just saying pregnant care, because I think this is the most common multivitamins, you know, women buy. So you have everything in this branded product. So which, you know, at the end of the day, saves you a lot of stress having to remember to take tablets and all. With just one tablet, you're good to go. Then another thing that is very, very crucial that you may not find in something you consume every day is vitamin D. Although we've got vitamin D in egg, we've got vitamin D in milk, but then the amount of vitamin D you need daily in your body system, especially as a Black woman living in diaspora, living abroad, where winter takes more than half of the year. Guys, you need to include vitamin D supplements in your daily medication. Okay, vitamin D, very, very, very important. You could still have your milk, have your eggs, but then you still need the tablet supplement. Okay, so that's that about multivitamins in pregnancy. And to the last question, I don't know. Honestly, I don't know. For me, I was so conscious of the fact that I don't want to put in pregnancy. Is it going to smell? Is it going to? Then I made it, you know, a duty to always go to the toilet every day as much as I can. I don't want to poop in pregnancy. I don't want to poop in pregnancy. But guys, if you are still going to poo, you're still going to poo. You cannot. Sometimes these things are unavoidable. These things are unavoidable sometimes. So just leave your body. As a matter of fact, when midwives, when we see poo, is a sign that the baby is close. Because if you are in labor, you won't just suddenly start passing poo when the baby's head is not down, you know, down in the vaginal canal. So seeing poo is a very good sign for us midwives. So it's the least of your worries in labor. You want to give birth to your bundle of joy. You want to hold your bundle of joy. I think that should be of more concern to you than can I avoid pooing? What can I do to avoid? Focus on the baby you're about to push out. Okay, forget about poo. If you poo, we are ready for you. We are happy to pack your poo. It gladdens our hearts to see poo. Okay, so guys, just forget about can I poo, can I not poo. So this brings us to the end of this video. If you have gotten value from this video, please give this video a thumbs up, like this video, and share. If you haven't subscribed yet, kindly subscribe to my channel, and you know, and expect more valuable content from this channel. Till we meet again next time, bye.